Okay, thank you so much. Go ahead.
Okay, thank you so much, Ms. Dillard. Can everybody hear us or hear me? Great. Well, I'd like to start by thanking Sentara and the Starr Health Center for inviting Patrice and me to represent the Hep C program this evening. We have two other team members who aren't here tonight, but Patrice and I are really glad to be able to share our passion for curing hepatitis C. So we're delighted that you all have come to learn more about that. And I'm going to share my screen and hopefully that will work fine. Let's see. Are you all able to see my screen? Okay, good. So Patrice and I talked a little bit about how we'd like to do this, and we really just work hand in hand to bring the exciting new treatments, the exciting new cures for hepatitis C to people all around Charlottesville, Albemarle, the surrounding counties, and even across the state. So I'm fortunate as an infectious disease specialist that I get to work with people on the medical side of it. And I'm going to talk a little bit about that without exhausting you all with too many, charts and graphs and things. I'd really like to just make sure everybody really understands what Hep C is and how we can get rid of it. Now, Patrice is the lucky one because she really gets to work closely with the patients as they walk through their journey of discovering perhaps that they have hepatitis C and also then subsequently putting it in the rear view mirror, as we like to say. So I'm going to pass it back and forth with Patrice. I'll give you some slides and then every once in a while I'm going to stop and Patrice is going to give you some more personal reflections on what it's like to be a nurse and to walk with someone through this process. And I'd like to invite everybody to ask questions. I'm going to try to watch the chat and I'll try to answer in the chat if you have something. If not, we're going to have time for questions at the end of the talk. So whatever you're comfortable with, and definitely open to answering anything that comes into your mind while we're talking about this. All right, so you can see my title slide. It is time for a cure. We first learned what hepatitis C was in 1992, and we had some treatments in the late 90s and early 2000s, but in 2014, we really got a cure, and that's what we want to talk about. So what are some of the big questions we're going to address today? First off, what is hepatitis C? Hepatitis C, I'm going to tell you more about it, is actually a very common disease, the most common disease that's spread through blood in the United States. But maybe you don't know what it is. And so we'd like to make sure everybody's on the same page about what hepatitis C is. Next, what does hepatitis C do to the body? Sometimes people don't think too much about hepatitis C because, as I'll mention, sometimes people don't have many symptoms, at least initially. But I'd like everybody to know what hepatitis C can do in the body. Also would like everybody to know who should be screened. The answer is pretty much everybody, but as you all are living in the community, whether you've been screened or not, you can definitely make your own decision about that. But also I hope as leaders in the community, you can advocate and support people who might need to be screened to go and get that screening. Next, is it an important problem in our community? I imagine you're probably thinking, well, that's a silly question because Ms. Dillard wouldn't have invited me to talk about it if it wasn't, but it is an important problem. And I'm going to show you a little bit more at the state level, what we're facing with hepatitis C, and also what our opportunity is to hopefully eliminate it. I'm going to talk a little bit about why we should treat hepatitis C and what that cure looks like. So that's kind of our outline for this evening. So what is hepatitis C? Well, it's a virus. It is a virus that attacks cells in the liver. So you can see that picture kind of looks a little bit like some of the pictures you may have seen of COVID. It's a different kind of virus, obviously, but you know, it is still a tiny little germ that gets in there and really targets right in on the cells in the liver. It lives in the liver, and it can do a lot of damage in the liver, but I'm going to emphasize to you throughout that while it largely lives in the liver, it can affect the whole body. We call it hepatitis C because the way that we know that people are infected often is because we may see on a blood test that the liver is just a little bit inflamed. And that's what hepatitis means. Hepatitis means inflammation of the liver. And sometimes it's caused by viruses like hepatitis C or some other viruses like hepatitis A or hepatitis B, but it can be caused by other things as well. Things that you might think of would be alcohol is a particular toxin for the liver. Taking too much of some medications, even over-the-counter medications like Tylenol, can also cause inflammation of the liver. But in this case, this hepatitis that we're talking about tonight is caused by the hepatitis C virus. So just as a quick review, you may remember back in health class in high school or college, learning about what the liver does. So the liver is an incredibly important organ. And as I mentioned, it is the place that the virus targets first. The liver processes nutrients for us. It helps us process fat and protein. It also filters our blood. So one of the reasons that things like alcohol or Tylenol are so hard on the liver is because one of the liver's main jobs is to protect us from toxins like that. So if we give it too much to do, drinking too much alcohol or accidentally taking too much Tylenol, that can be hard on the liver because it's filtering those toxins, poisons out. It also produces important proteins to help our blood clot if we get a cut, for example, and it also helps us fight infection. So a really important organ that we want to keep around, not like we can do without it like a gallbladder or something like that. Okay, so what can hepatitis C do to a liver? So you see on the upper left-hand side, kind of that nice, healthy looking liver. If you were to feel it, you may know this also from buying liver at the supermarket or something like that, it should be pretty squishy, should be sort of sponge-like. As the liver is damaged, whether it's by hepatitis C, which is what we're focusing on tonight, or by another toxin or irritant, alcohol would be the other common one, we develop chronic hepatitis. And again, as I mentioned before, hepatitis refers to inflammation of the liver. And so as the liver cells are damaged, they start to get scarred. They release these enzymes that we measure in the blood, and your doctor might say, oh, I'm starting to see that your liver is a little inflamed, and as it remains inflamed, it can get harder, and if you squeezed it, it wouldn't be as spongy anymore. It would be starting to get sort of stiff. Now, one of the amazing things about the liver is that it is the only organ other than the skin that can heal itself. So this is really important when we're thinking about why to get treated for hepatitis C, why to make sure that you know if you have a treatable cause of inflammation of the liver, is that the liver can get better. So you can go backwards. You see the arrow going from left to right there, from healthy liver to chronic hepatitis, but there should be another arrow in there that means that you can go back. Okay, so really important to know that your liver can heal itself. Now, there's only so long that the liver can heal itself. As you move down on the right-hand side, you see that kind of knotty looking liver at the bottom right that has cirrhosis. That's more end-stage liver disease. And at that point, the liver can't turn the arrow around and heal as easily anymore because it's so scarred. And then in some cases, for people that have really advanced liver scarring or cirrhosis, that will predispose them to developing liver cancer, which is something that we really want to avoid. So as we look at that cycle, that is the cycle that we want to break by treating and curing hepatitis C. It's important to know, and we're going to talk about testing for hepatitis C in just a moment. It's important to know that some people who get exposed to hepatitis C, they just get rid of it on their own. They're not better people, they're just lucky. And about 50% of people may actually clear the virus on their own. So we're going to talk more about that. I want you to keep that in the back of your mind because we're going to talk more about that when we are talking about testing. Okay, so I think you heard me say, yes, I was showing you pictures of the liver. I showed you those ugly pictures of livers getting damaged. But hepatitis C, even though it prioritizes the liver, it does a lot of other stuff too. So sometimes people will have hepatitis C and it doesn't really bother their liver that much, but it's important to remember that there may be other really good reasons to get treated, even if it's not bothering your liver very much. So it can actually make diabetes worse. It can also cause kidney disease. You see the word glomerulonephritis there. That is inflammation in the kidney. There's essential mixed cryoglobulinemia, which is an autoimmune disease that can develop in the context of hepatitis C that causes disease in the blood vessels of the skin and kidney. There can be some really painful rashes. It can even actually precipitate other kinds of cancer than liver cancer, including lymphoma. And some of the things that people talk about all the time, the things that I've mentioned up to this point are pretty rare, but obviously very important. The diabetes one isn't very rare, but the other ones are pretty rare. But things that a lot of people notice when they have hepatitis C is that they have brain fog or a whole lot of fatigue. And those are real symptoms that are extremely disruptive for people's lives, and we want to try to take care of them. So how does it feel to have hepatitis C? I'll let you read this. I won't read the whole thing, but I just want to note that this was a patient that we were very privileged to take care of, and he said we could use this quote. And he's talking about how much it worries him being around his wife who has a disability and he cares for. And he told us, he just, before we were able to treat him, he just worried all the time because he felt like he had this terrible infection that he could spread to her. We're going to talk more about how the infection actually spreads, and I'll tell you right now that he didn't need to worry so much. But I want you to imagine what it would be like to feel like you always had this infection that you were worried you might spread to your family, and also an infection that carries a lot of stigma. And you might not be comfortable talking about it, and you might not receive a lot of support for it. Patrice, at this point, I wonder if you might be able to say a little bit more about what you've heard from patients about what it feels like to have hepatitis C.
Mm-hmm. Definitely. I had this one patient who came to us for treatment, and she said that hepatitis C was like a constant reminder about the bad choices that she made when she was younger. When she got diagnosed with hepatitis C, it was like her past was coming back to haunt her, you know, and she felt bad. She felt like she couldn't, like her daughter had a baby and she felt like she couldn't even like hug or kiss on the baby because she didn't want to give him hepatitis C, you know, and she felt like she had this germ, these cooties, I tell my kids, but like it was just terrible. It was terrible for her. And I tried to educate her as best as I could, but I told her that, hepatitis C can be transmitted through blood. So, you can hug the baby and kiss the baby like grandparents do, they hug and kiss the babies. That's what you need to do. Go home and hug and kiss your baby. And I actually set her up and scheduled her with an appointment to get treatment. And she successfully, completed her treatment, and she's cured of hepatitis C.
Thank you, Patrice. Yeah, it always breaks my heart when I hear that people are staying away from their children or their grandchildren because they have hepatitis C. Because just as Patrice said, just being with somebody, eating with somebody, kissing or hugging somebody when you have hepatitis C, that's not the way you spread hepatitis C. So let's talk a little bit about how you can contract hepatitis C yourself, or how if you have hepatitis C, you might be able to spread it. So one way that people can spread hepatitis C or contract hepatitis C is by sharing non-sterile drug injection equipment, and also drug snorting equipment. So sometimes, people are using substances and they might not have their own needles, or they might not have their own equipment for injection. They're struggling with substance use disorder and they don't have access to clean equipment. We always try to encourage people to remember that now in Virginia, there are options for obtaining clean equipment if you are using injection drugs and drugs that you inject. And we really encourage people to ask their doctors about that, to find out where in the community they can get it, because sharing that kind of equipment, whether it's needles, whether it's maybe cottons that people are using to filter drugs, that sort of thing. All of that, if it has a little bit of blood on it, it can spread hepatitis C. Sometimes people also think that it's safer to snort drugs, and that is not an unreasonable thing to think, but it's actually not true. So if you are snorting drugs and using the same straw or the same bill put into a straw to snort drugs, then you can also get hepatitis C that way. So we really encourage people, if that's something that is a part of their lives, to make sure that they are protecting themselves and the people they love by using their own equipment. In addition, hepatitis C can be spread from mothers to their babies. It's relatively rare. As you can see on the screen, it's only about 6% of babies who are born to moms that have active hepatitis C that will have hepatitis C. And this is important to know, and it's one of the reasons that obstetricians now in this state will always want to check moms for Hep C so that they can help them prepare for that. Unfortunately, we don't have treatment right now that can be used while women are pregnant, but we can treat people before they get pregnant or after they've delivered the baby. And we're fortunate that now we also have better medications for young children starting at age 3 if they do contract hepatitis C. It is very rare for people to contract hepatitis C in a healthcare setting now in the United States. In other countries, it may be different. And also, prior to 1992, when hepatitis C was discovered, there weren't all of the same practices. So some people may have contracted hepatitis C, particularly our elders, may have contracted hepatitis C from a healthcare exposure. Sex is not a great way to spread hepatitis C. Very unusual that actually does spread it, but we'll just mention it there. Unregulated tattoos or body piercings. We really try to talk to people, young people in particular, that if they are getting tattoos, want to make sure that they see the needles opened out of a clean package, that the ink is ink from a new bottle, not from a bottle that's been used by somebody else. Sharing personal items. Now, we talked about how grandmas and grandpas should be able to hug their grandchildren even if they are waiting to get treated for hepatitis C, but it is important in the household not to share things like razors or clippers, toothbrushes, certainly anything that could have a teeny tiny bit of blood on it. We want to make sure that that is only used by one person. And then I've mentioned 1992 a couple of times. That's when we really could start testing for hepatitis C and understood what it was. Blood transfusions prior to that could have transmitted hepatitis C. Okay, how will I know that I have hepatitis C? Well, I've got that scared face. You probably won't, because a lot of times people don't have any symptoms whatsoever. So it's really important to get tested. I sometimes draw the analogy to high blood pressure. You know, sometimes people won't know that they have high blood pressure until it gets really high and starts causing damage. And that's why it's really important when you have the opportunity at a community event or at your church or at your doctor's office to get your blood pressure checked. I would argue it's the same thing for hepatitis C, because you just may not know that you have hepatitis C, because a lot of times it doesn't have any symptoms until it's been around for a long time. So testing is actually recommended for almost everybody by the CDC and the health department. So everybody over 18 is recommended to get testing for hepatitis C at least once. Especially people who are pregnant should get tested to make sure they can't pass it to their babies. If people are currently injecting substances or have ever injected or snorted substances ever, even once, I really want to emphasize that it's important to get tested. If you are living with HIV, it's really important to get tested because hepatitis C can move more quickly. If you've ever had even minor elevations in your liver tests, get tested. Pretty much, I don't need to read all this to you. Everybody should just get tested for hepatitis C. So Patrice, can you say a little something about where are good places to get tested for hepatitis C?
Yes. So I was going to say the exact same thing. Everybody should get tested at least one time in their life. Health departments would be a good place to start. Suboxone clinics, primary care doctors' offices, community events, and CVS Minute clinics, but you have to make an appointment. But those are, mainly the places to get screened. And like when you go to community events, they're going to probably do the hepatitis C antibody test, which is like a prick, like you prick your finger if you have diabetes or something to check your blood sugar. It's just a prick, and then it tests to see if you have the antibodies, if you've ever been exposed to it. So those are all good places to get, to start,
Thanks. Thank you, Patrice. And that's really true. We're really lucky that a lot more places have started doing hepatitis C treatment. And a lot of doctors' offices will have an alert pop up on their screen to remind you, to remind the doctor to get tested, to test patients for hepatitis C, because as Patrice was saying, everybody should get tested. And so I'm seeing here in the chat, is it unusual for a PCP to test a patient without being prompted? No. Because it's actually a quality measure now, because everyone is supposed to be tested. So that's kind of what I was referring to. Like when I pull up someone's page chart on the electronic health record, I'll see on the side, there'll be little red dots that say, these are things that this person is supposed to have had for them to be achieving their best health metrics. And hepatitis C will come up as one of those things if you are over 18. So I think that's great because, Hep C is, I'll show you the numbers in a minute. There are so many, it is not a rare disease. And we need to bring it out of the shadows if we want to make sure that everybody has a chance to get cured. Great question. Okay, so just a couple of words about the Hep C test, and Patrice was mentioning this. The Hep C test, depending on where you are, may just test for the antibody to hepatitis C. So the antibody to hepatitis C is telling us that your body has been exposed to hepatitis C at some point, and it has effectively created it has tried to protect itself. Now, I will tell you that the antibodies that are created against hepatitis C, unfortunately, are not effective at killing hepatitis C. There are some antibodies, like antibodies to measles, for example. If you get the vaccine against the measles, or if you have ever had the measles and you have those antibodies, the next time your body sees the measles, it's going to take care of it. Unfortunately, the hepatitis C antibodies are not that effective, but they do tell us that someone has been exposed to hepatitis C at some point. It's also important to remember something that I mentioned before. About up to half of people who are exposed to hepatitis C will get rid of it on their own. So sometimes people will have hepatitis C antibodies. They never knew they had hepatitis C. They never got treated for hepatitis C, but their hepatitis C viral load, so that's the test that actually tells you whether you have an active infection, is negative. And that's because their body, for whatever reason, was able to clear the hepatitis C. Now, if your hepatitis C viral load test is positive, meaning that they can count the number of hepatitis C viruses, you know, that picture that I showed you that are floating around in your blood, if we can count those in your blood, that means that you actually have active hepatitis C, and you should look into getting treated. So I promised you some numbers. Oh, great question, Ruth Williams. How often should you get tested? So for most people, the recommendation is only to get tested once. However, if you are concerned that you may have had additional risks for contracting hepatitis C, you should get tested more often. So for people who are exposed to other people's blood, they should get tested regularly. But for those who are not sure, maybe they had an exposure at some point, one test is enough.
Question.
If you have it and you get cured, can you catch it again? That is a great question. You can. Absolutely. And while we're on the testing subject, for anybody who's had Hep C before, and hopefully you've been cured or have just cleared it on your own, if you're worried that perhaps you've had another exposure, you should make sure to get tested again, and you should tell the doctor or the lab that's doing it that you need the hepatitis C viral load test, because you want to know if you have active infection. If you have ever been exposed to Hep C, your Hep C antibody will always be positive. Okay. If you are treated, your hepatitis C viral load will go to 0 and it should stay at 0. Mm-hmm. If you were to get reinfected, the viral load would go back up, but we would have to test the viral load and not the antibodies. We can come back to that if that's confusing. Okay, so this is a graph that's showing the number of people who are living with active hepatitis C, and it's comparing them by age, as you see on the x-axis, and then also by gender. So the blue is for people who identify as male, and the orange is for people who identify as female. So as you look at this graph, first off, at the top, 2.5 million Americans, that's a lot of people, have active hepatitis C. And you'll see that it's more common in men. And there's this funny double hump. So it used to be that we talked a lot about baby boomers having hepatitis C. And one of the reasons for that is something that I mentioned earlier. And that is that before we knew about hepatitis C, there were not as many safeguards as there are now. And people may have been exposed in healthcare settings or in the military. I don't know if anybody remembers those old vaccinators that were the air vaccinators, and people would just go along and do air vaccination. That may have been a way that it spread. There are a lot of people who had no idea how they got it. They were born between 1945 and 1965, and they had it, and they didn't know how they got it. So that's the second hump over on the right-hand side, is people who are a little bit older. But unfortunately, and we'll talk some more about this, and I hope that you all as leaders in the communities that you live in can help to warn people, young people, about the risks of hepatitis C. We are seeing so many more young people with hepatitis C, and we'd really like to get the word out so that they can protect themselves. You can see here that between 2013 and 2019, the rate of new cases of hepatitis C doubled. And some of that was because of more testing, but the reality is there were also just a lot more cases. So this is what I was mentioning to you earlier about showing a little bit in this state. And this is us. I hope you can see my pointer. You can see us here in Charlottesville with Albemarle around us. And this is about 10 years ago. Now, as many of you probably know, in far Southwest Virginia, in Appalachia, they were very hard hit by a number of things, including the opioid use disorder epidemic and also by viral hepatitis. Those two things often go hand in hand. So the darker colors are areas where there is more hepatitis C. And as you see over the last decade, those dark blue areas have spread. Some of them have gotten darker, particularly in far Southwest Virginia, but also over in the Petersburg area, over here in the Piedmont, starting to see that. And also in counties that are our neighbors. We're seeing a lot more hepatitis C. And so, unfortunately, despite the fact that in this decade we have had a cure, we're actually seeing much more hepatitis C. So we really want to make sure that we get the word out, both about how to prevent it from happening in the first place, and also to make sure people know that there is a cure. Mm-hmm. These are the numbers in Virginia, and we've sort of seen this in that graph that I showed you nationally. This is from 2012, so a little more than 10 years ago, and you see that predominance of men in blue, and you also see back then that it was older people that had hepatitis C. Now you see this younger group of people with hepatitis C. So hepatitis C treatment. Back in the day, before 2014, we used medications that included interferon, which is an injectable medication that essentially makes you feel like you have the flu. And you had to take it for a year. You also had to take it with a medication called ribavirin, which I hope none of y'all ever had to take because it drops your blood count and it makes you really angry. So that was horrible. And at that time, you had to do this treatment that made you feel terrible and enraged for a year. And it was about a coin flip whether it worked. So I want all you to understand that, because sometimes people who knew about hepatitis C back in the day will be really afraid to come and get treatment. And you know what? They are not wrong, because the treatment back then was horrible. As a doctor, I mean, I wanted to help people get cured, but it was terrible. People were so sick and so miserable. And a lot of times they really couldn't even work. So it was more like chemotherapy. Patrice and I are here to tell you that it is not like that anymore. We have medications that are taken by mouth. Patrice is going to tell you a little bit more about that in just a second. And there are very few side effects, and 95% or more of people get cured. So Patrice, you want to say a little bit more what it's like to get treatment now?
Yes. So like Dr. Dillingham said, it is so much different. So with telemedicine, you only have one doctor visit. And it doesn't matter what type of insurance you have. You can have Medicaid, you can have Medicare, you can have commercial insurance or no insurance. There's treatment options available for everyone. For Medicaid and Medicare, there's no copay. For commercial insurance, if you have like a high deductible, the specialty pharmacy will send their script to the insurance company, and they'll enroll you in like a grant program, which will offset the cost of the medication. If you don't have any insurance for whatever reason, we can also set you up with like a patient assistance form along with the required documentation. And then you can get your medication at no cost. So there's options for everybody. Like Dr. Dillingham said, it's a 95% cure rate. Two complaints that people say is that they have a headache and they're fatigued. And that's normal. The headache will go away once you like power through the first 2-3 weeks of treatment. It'll get better. But that is the probably the most terrible thing that everybody says about treatment. And the headache will go away. Like I said, you just have to, like, if you take your medication in the morning and you get a headache, we'll tell you to switch it up, take it at night, so you can you won't really know that you have a headache because you'll be asleep. Or if you're fatigued, we'll just ask you to like stay hydrated, eat well, get a good night's sleep, and eventually, I'm telling you, it goes away. All of my patients said it went away, but that was the hardest part. So
thank you, Patrice. Yeah, and thank you for mentioning the cost also. The cost of the medication, if you paid for it out of your pocket, is just ridiculous. It does. I'm not sure exactly who knows what the actual cost is, but they charge about somewhere between $35,000 and $45,000 for the treatment, which is jaw-dropping. It's actually a little bit better than it used to be, but the reality is that it makes sense to get treatment because of all the other horrible things that can happen if you don't get treated. And we're really fortunate, particularly in Virginia, that there's very good coverage for the medication. And as Patrice was saying, most people have no copay at all. So really good questions coming in. What's the difference between hepatitis B and hepatitis C? That's a great question. So they are both caused by viruses. They are two very different viruses. And I could probably do a whole nother lecture on that if you really wanted me to, but I would argue that the most important difference between hepatitis B and hepatitis C is that hepatitis C is curable. Hepatitis B is treatable, but you can't get rid of it. It actually integrates, it gets into the cell, into the liver cells, and it makes itself a part of the liver cells. And there's no way to completely get rid of it. There's always a little bit of virus that's still there. So it can be a little bit more of a problem because it can come back. For example, if somebody needed cancer treatment, that sort of thing, it's not really curable, but it's very treatable. Oh, another important difference is there's also a vaccine for hepatitis B that really works. So hepatitis B is not curable if you get it. It's treatable, but there's a great vaccine for it, and everybody should get that. Hepatitis C, on the other hand, also caused by a virus, but it's curable. It doesn't make itself a part of the liver cells. And so when we treat it, we're getting rid of it completely. And another great question is, how long is the treatment? Patrice, you want to take that one?
Mm-hmm. So treatment, you're going to take, like if you're taking Maverick, you'll take 3 pills 1 time a day for 8 weeks. If you're taking Epclusa, you'll take 1 pill for 12 weeks. It just depends on like what other medications you're taking, because they, you don't want to have an interaction with the drugs. But yeah, so it's 3 pills all at the same time, 1 time a day. And then for Maverick, and then for Epclusa, like I said, it's 1 pill, 1 time a day for 12 weeks. But both of them have a 95% success rate.
Okay. So just as a review, why should we treat Hep C? Well, certainly we can reduce the risk of developing cirrhosis and liver cancer. That's really important. Interestingly, we've actually seen in large studies of populations that treating hepatitis C reduces your risk of death overall. So that's pretty great. And part of that may be because hepatitis C, getting treatment for that actually can reduce the risk of heart attack, stroke, and kidney disease. And you remember that I mentioned that we always think about hepatitis C as a liver disease, but as we think about it more, it really is a whole body disease. So even if your doctor says, oh, your liver enzymes aren't so bad, don't worry about it. Remember that that virus, even though it lives in the liver, it's causing trouble all over. Another thing that I think is really important is sometimes we dismiss kind of the mental health components of living with a chronic infection, and I think we don't measure them enough. This is from a study actually out of Kyiv, Ukraine, and it looked at people, about 900 people who had been treated for hepatitis C. And look at this, if you look at these bars, you see that people reported improved focus after they were treated. They reported that they had no fatigue after they were treated, and even their chronic pain was improved. So there are lots of really great reasons to treat hepatitis C. And I really like this quote, and Patrice mentioned something similar to this. I feel like getting rid of this was the last hold that my addiction had. Because of my addiction, I've done a lot of horrible things to my body and to the people that I love. And I feel like by getting this treatment, it was like curing the last thing, the last string that my drug addiction had hold of me. Mm-hmm. So that is a really nice thing for us to hear from patients. And Patrice, what else would you say about that?
They're very, like, all the patients are so happy. They're so grateful. I have several patients. It was so weird. They both said the same exact thing. They said, I feel like a black cloud has been like lifted from off the top of my head or over my head or something similar to that. And I thought that was interesting. And many of the previous patients show their gratitude by actually referring other patients, because they'll tell them how easy the treatment is. It's not like, how it was back in the day, and they'll refer people to us and we'll treat them. And I feel like that's a good way to like eradicate hepatitis C altogether. Yeah.
Absolutely. I'm going to skip this slide and skip to this one to show you. And we hope that you all want to be part of getting the word out to get folks treated for Hep C. So you'll remember that date 2014 is when we had really good treatment, and we got off to a great start. But unfortunately, over the past 5 or 6 years, treatment has actually gone down instead of continuing to go up, and it got even worse during COVID. And so this is something that really concerns me, because I hope we can get the momentum actually to put hepatitis C in our rearview mirror as a community, as a country, because we can. Mm-hmm. Unfortunately, even though people are often, most people are insured, this is showing that people who buy different types of insurance, so whether they have Medicaid, Medicare, or private, we're still leaving the majority of people untreated. And I think that part of that is because people aren't aware that there's a curative treatment. They may be scared to talk about it to their doctor, or they're afraid because they remember what the old treatment was like. So we hope that y'all can be part of getting the word out. I'm also really proud of Virginia in this regard. Virginia, and particularly Virginia Medicaid, has made incredible strides, and they have been recognized nationally as a place that's really doing the right thing with hepatitis C. The medications are available, and they're available without judgment to everyone who needs them. And that, I think, is really important. We've had a wonderful partnership with the Virginia Department of Health, and if you'd like to learn more about it, there's our website at the bottom. That's another reason that I'm really proud of Virginia in terms of hepatitis C, is because the Virginia Department of Health has really made it a focus, both in terms of treating people and also supporting getting providers and clinics trained to make sure the treatment is available. So this is the slide about Hep C elimination. I've mentioned that a couple of times. The estimate is that if we keep going the way we're going and maybe accelerate a little bit, that we could actually eliminate hepatitis C in Virginia by 2033, which is really, it's only 10 years away. That would be pretty amazing if we could do that. And we hope you'll be a part of that. Answering another question, if someone gets it again, is it likely to be cured twice? It is likely to be cured twice. And we're fortunate that most insurance will cover the second treatment. Of course, we want to empower people to know how they can avoid getting infected again, but it happens. And what we want to do is make sure that people still have access to that treatment, and getting them cured again is not a problem. So this is another quote from a patient. I feel as though I can breathe again. That was a young mother who'd really struggled with addiction. She had 3 children now, and she was just looking forward to putting that all behind her. And this is what she told us. And that really felt good to Patrice and to me. And we hope that if you have loved ones or people that you care about that are living with Hep C, that you'll let them know, or if you are, that you will know that there is an option. We can cure it, and we want to help everyone who needs it in Virginia and beyond get cured. So thank you all so much for your attention. Thank you again, Ms. Dillard, for inviting Patrice and me. And we would be happy to take questions in the last few minutes that we have.
Well, one question I had was, what side of your body is the liver on? And secondly, does it affect the gallbladder?
Yeah, good question. So the liver's on the right side of the body, and typically hepatitis C does not affect the gallbladder. As you may know, the gallbladder is tucked right up under the liver. The liver kind of protects it there, and they are connected through a duct. But typically the hepatitis C doesn't affect the gallbladder.
Well, you also talked about pain. Do you get pain with your in your liver if you have problems?
Yes, sir, you can. So sometimes people will have pain in their liver, especially if it gets a little swollen. So they'll say, you know, the right side of my stomach is hurting, especially if there's any other stress on the liver. Sometimes people tell me, I stopped drinking because my liver kept hurting me. And what it is, the liver's trying to deal with the hepatitis C. You put some alcohol on top of that, and ooh, that really hurts. Yes, sometimes there is pain, but I would say that the majority of the time there is no pain, which is good in that there isn't any pain, but it's also bad that you don't get a warning.
Thank you.
You're welcome.
Should people ask their primary care doctor to be tested if they're curious and that?
Yes, they should. And they should know that that is actually the recommendation for everyone.
Do you see much pushback with primary care doctors testing for that? You know, if someone asks and they might feel like, oh, you don't have that, you know, sometimes you can get pushback.
That's a really good question, Sator. So I think, you know, lots of, you know, doctors too may not know how much has changed in the last 10 years with hepatitis C. And depending on when they went to medical school, you know, when I went to medical school, there wasn't a cure for hepatitis C. So they may not be paying a lot of attention. And I think we do have to be honest about the stigma associated with hepatitis C, and that some people may, you know, look at someone and think, oh no, you know, you're not that kind of person. Well, you know what? It's not that kind of person. Anyone can get hepatitis C, and everyone should be tested for hepatitis C. So for your own health, I would say, yes, please do ask for a test. And I would say most docs, especially, and nurse practitioners and physician's assistant, whoever your clinician is, most of them will be aware that that is a recommendation that everyone be tested for hepatitis. And it's paid for by insurance because it is a recommendation by the United States Preventive Services Task Force, which is what insurance companies have to follow in terms of paying for preventive care.
Yeah. Yeah, when I went through nursing school, it was not, and that was back in the 80s when I graduated, early 80s. So I was actually surprised when I learned, you know, that it's treatable and curable, you know, because years ago it was a death sentence, as they say, is what I had learned anyway.
Right. Oh, it's kind of amazing that in our lifetime things have changed so much. I mean, really, in the last 10 years.
Yeah. Well, thank you so much for doing this presentation, and you, Patrice. We really appreciate it. And as I said, it'll be recorded, and then we do upload them to our YouTube account. So anyone who missed it will still be able to view the presentation. Does anyone else have any questions that we missed?
Yeah, I've got one. I had a blood workup from my family physician, and what was flagged high was the SGPT ALT and the SGOT AST. Are they connected to hepatitis C?
Well, those are enzymes that come from your liver, and they can be high if there's any reason that your liver is a little bit irritated. So I would definitely talk to your doctor about that. And if you've never been tested for hepatitis C, you should be tested for hepatitis C.
So that's independent. That's independent of what I had tested then.
Yeah.
Okay. Thank you.
You're welcome.
Thank you very much. It was really good. And I'll get my doctor to let me get tested too. So thank you.
Thank you.
Yeah.
Thank you so much for all your participation, everyone.
Definitely.
Yeah, thank you. It was really great. We really appreciate it. I think we all feel like now we should make sure we get tested.
Good. Yay. Good job, Patrice.
Great.
We'll all be asking our doctors when we go for our checkups. But
Is that an expensive
great
test?
information. I'm sorry, say it again.
Is that an expensive test?
It should be covered by your insurance.
Okay. Super.
Anyone else? Thank you so much. This was very informative from Virginia. And another thank you, Tiana. So folks are just thanking you.
All right. Well, I hope everyone has a great night. It's beautiful out.
For you too. The sun's going down, but you can catch the the sun going down. The sunset. Looks like it might be pretty. Thank you everyone for tuning in, and for my regular group folks, I'll see you next week. And it is Fresh Pharmacy tomorrow for my group people. They know what that means. All right, everybody have a great evening. Thank you all so much.
Bye-bye.
Okay, bye-bye.